It's not just southern states, even states in other parts of the country, even states in other parts of the country that have done relatively well over the last weeks and months. In Massachusetts, for example, Massachusetts brought its case numbers way, way, way down from what had been a scary peak in late April. But in Massachusetts, numbers have started going back up as the state has opened back up. And yeah, the positivity rate in Massachusetts right now is roughly 1/10 the rate they've got in Mississippi, but the trend is in the wrong direction. It is starting to go back up. Positivity rates are starting to rise. Case numbers are starting to rise. Anecdotal information about hospitalizations suggests that the uptick in hospitalizations in Massachusetts is starting to become systematic as well. And so epidemiologists in the state of Massachusetts are now telling that state's Republican Governor Charlie Baker that he should go back to what works. He should go back to the so-called phase 2 operations the state was under before, when the case numbers are being held very low and slow, and Massachusetts looked like a model for the nation. Go back to that. Since Governor Baker said, no, I want to move forward and go to phase 3 with indoor dining and all the rest of it, well, that's when the numbers have started going back up. So why would you stick with that? One expert from Boston University School of Public Health telling the Boston Globe now, quote, I would back up to the last level the governor had that we know worked. Somewhere between that and now is the sweet spot. Level 2 worked. Level 3 didn't work. Right. When your case numbers are going up, your positivity rate's going up, your hospitalization numbers and your death numbers are going to follow that trajectory too. If that's the trend line you're on, it means what you're doing isn't working and you have to do something else. If you had been doing well before and now you've stopped doing well, go back to what you were doing when you were doing well. It's not rocket science. We don't have a cure. The only interventions we have are these simple, dumb, hard things that we fight over. Masks and social distance and keeping schools closed and keeping workplaces closed and having rules about gatherings. That's all we've got. It's not rocket science, but you do the things that work. And when your numbers show you that new things that you're trying don't work, you stop doing them. But you know, who's to tell you what to do? Who's to say? If you even got advice from the top doctor working at the White House on these issues, should you follow their advice? She was picked for the job by the president. The president says she's terrible now and is disparaging her and dragging her for political effect. So do you listen to her? Who's to tell you what to do? Do you listen to the president?